Shanbhag. So, in a usual setting, clinical setting, we usually have the guest coming in, he washes his legs and he dries them and then lies down on the massage table, and the treatment goes on for about 30 minutes. But today, for the sake of demo, we are going to have Mr. Nachiket sit, and Angel is going to take his leg and on his knee and show a short 5-minute demo. Again, these steps are just 5 among the 30 steps that he would be doing. So the first step that we'll be starting is introductory touch, where we'll be gently compressing and squeezing, the way he is right now, the sole of his foot. The first introductory touch is very important. That prepares all the soft tissues of our legs and gives signals to our brains that, okay, I'm going to start doing a therapy on you. The next step that he's going to do is, by his thumbs, he's going to give pressure at the inner line which joins from the base of the toe to the heel and back up. Stimulating that medial line usually relaxes the plantar fascia or the plantar fascia that we have, which holds our foot in the position that it is. Usually people with arched foot or pain at the arch of the foot or flat foot, for all of them, this stroke is very, very important and nice to circulate the blood all over the feet. The next step that he'll be doing is circulatory stroke, circulatory thumb pressure along the inner margins of his foot from the base of the thumb or the toe, big toe, and going down to his heel. He's doing it so beautifully. It relaxes all the murmur points or the reflexology points, which are also there on both our feet, and takes care of all the vital organs. So he went back down towards the heel, and now he's coming back up from the outer margin. Once this gives a lot of relaxation, it takes care of any inflammation or edema in your foot. It takes care of leg cramps. Once he's done, he's going to start doing the same circulatory movement on all the toes, one by one. In reflexology, it is similar, when you see a foot, it is similar to how your body is. So the toes are all related to your sensory organs. It's eyes, ear, nose, tongue and skin. It relaxes all the 5 sensory organs. Once the toes are taken care of and the base of the toes are taken care of, he is going to then do a stroke which has his palm at the heel and then second one at the top, and gently squeeze and twist on alternate sides. This is very good for the range of motion of your feet. If you're having problems with walking, or if there is, while walking, if you have a tendency towards getting inflammation or pain at a side of the foot, this is a very good stroke for that. Twist and gently squeeze. And then he'll be finishing up, rounding up his final stroke. That is again gentle compressions from the heel or the toes down to the heel and back up. He's wonderfully doing a job. That increases a lot of blood circulation at his feet. How do you feel?
Yeah, it feels really good.
Right, thank you. Thank you, Angel.
Thank you.
Thank you.